Hello, I'm Roslyn Nieves. Welcome to QPTV's Health Update. I'm with Dr. Debra Weinstock. She's a podiatrist, and we're going to talk about women's feet today and men's feet also. The first thing I'd like to ask you, doctor, well, first, welcome.
Thank you.
The first thing I'd like to talk to you about is women's feet. What is the most common complaint that women have with their feet?
I would say that the most common complaint that patients come in, particularly women, is pain in the front of their foot. It might be a bunion problem or a hammer toe or pain on the ball of the foot. It is very much related to the structure, the inherited structure of their feet, and then it's aggravated or helped by the kind of shoe gear and orthotic arch support treatment that the patient is wearing.
Now, is this caused by the type of heels that they wear? And I am definitely guilty of that.
Well, beautiful shoes sometimes cause sad feet.
Beautiful. I like that. Beautiful shoes cause sad feet. Now, what's a typical problem for men?
A more common problem for men, because again, men generally wear more healthy shoes. So it's very unusual to see a man with a painful bunion or hammer toe or even ball of the foot. They're more likely getting a walking injury. So they may have an arch sprain, a heel pain, Achilles tendonitis, something that's more of a muscle or a strain, something that's more of an acute injury as opposed to something that's more of a slowly developing a structural problem, bony problem that a woman would develop.
Now, I heard about something that's new, regenerative medicine. Can you tell us about that and what's new and innovative about regenerative medicine?
That is a very, very exciting procedure that we're now performing very actively in our office. Regenerative medicine we use regenerative medicine when a patient has a very painful foot problem, a bunion, a painful bunion, a painful heel spur, a fracture that hasn't healed. The patient generally has tried many different treatments in order to alleviate and resolve their problem. But unfortunately for the patient, all of their best efforts have not resolved the problem. So what we do is a special procedure, regenerative medicine, where we take the patient's blood and we treat it in a special way, we process it, and we end up with something called Platelet Rich Plasma. And what that is, it's the patient's blood that contains growth factors, 30 growth factors, plus very strong healing cells, and we inject the patient's own solution into the painful area. And we've had phenomenal results in resolving conditions that haven't resolved by conventional treatments.
So this is begun by simply taking the blood.
Simply taking the blood. There's no allergies for the patient. Everything is done right in the office, on the spot, and we've had the most wonderful, wonderful results from this procedure.
After the procedure, how quick is the pain alleviated?
Regenerative is where the body is healing itself. And so it's not a quick fix. The body has to repair damaged tissue, repair damaged cells, ligament, tendon, and even bone. And that takes weeks up to several months. So the patient's not going to have a quick fix, but they're going to feel better soon after the regenerative medicine injection, but it will take several weeks and even months till they're at their full recovery.
Now, how many injections are there? Is it one treatment of injections or a series of injections? How many?
Good question. Most patients do significantly well after one treatment. We say that you're going to most patients get a minimum of 50% improvement after one treatment. And for many patients, that takes them out of that painful cycle. Some patients do need to get a second treatment. I would also like to add, too, that we also do a special procedure that involves adult stem cells, where we do, not myself personally, but the doctor in our office does a mini liposuction of the patient in the office, takes the little fat cells from their belly, and then we mix it with the blood components and we mix it with the fat components of their belly. From the belly we get adult stem cells, and we all know that adult stem cells have a phenomenal regenerative property. So there's a lot to it, but we've been finding that it's been a great benefit for our patients.
Well, this is definitely innovative, and I'm glad we brought this information to our 475,000 viewers. I'm Roslyn Nieves, and thank you for joining us on QPTV's Health Update.